say something, you say no.
All right, welcome back, and we are continuing with our mental health series, and today we are looking at drug abuse prevention. We have Dr. Olajumoke Koyejo. You're welcome to the program.
Thank you very much.
Drug abuse prevention, there's drug abuse on one hand, and then preventing it is another hand.
Yeah.
Tell me, what's the best way we can, when you talk about drug abuse prevention, what would you say it really is?
Well, prevention is a science, and it's about preventing availability and accessibility to these substances of abuse. I would call them substances because they are more than drugs, as per what people know as drugs. There are so several other things people take that actually take charge of the brain temporarily. So for me, it's substance abuse prevention, which is preventing accessibility, availability, and empowering people to say no to these substances of abuse. That's what I would call it.
For me, what's a drug and what is a medication?
Yeah. Well,
and at what point does a drug become abused?
Yeah. Well, laymen call it drugs, but there are many more things that people abuse now. So let's call them, they are psychoactive substances. They are substances that work on the brain, and they are much more than drugs. Of course, there are medications that people use in a way that is contrary to what was prescribed for different purposes for which these substances were made. So at those points, you call there is an abuse of these substances. And there are several of them, and some are stimulants, depressants. Stimulants are the family of cocaine. Depressants are sometimes depressants are even benzodiazepines, which is a medication, family of Valium. Hallucinogens, that's mescaline, some forms of mushroom. Opioids are narcotics. That's a family of tramadol, codeine, heroin. They are in the same family.
Opiate, yeah.
And there are several other ones that are not even categorized into any of these substances, but they are much more than that. And my job here is not to suggest to anybody. They know what they take. We know what they take. They are our clients, and the whole idea is for us to prevent accessibility, for people to be able to empower people to be able to say no, and to reduce availability of these substances to the public. That's what prevention science does.
You mentioned some of these drugs that are on the counter. You can buy from the counter from a pharmaceutical store.
Yeah.
Recently, NAFDAC banned the sale of I think Sniper or so. But recently I went to a store and I saw this product displayed there. If we're talking about drug abuse really and prevention, are there ways that these off-the-counter medication that people actually abuse will not be sold or even present at such chemist or pharmaceutical stores?
Yeah, thank you very much. Well, we are good at making laws, but enforcing them is actually a problem in this country. And I keep telling people that the pharmacists are the custodian of medication from point of production even to the last point in which the patient, the last user, takes home. And they even advise the patient on what to do. So there's some medications that should not be sold without prescriptions, but you keep finding all those things around in Nigeria. So that's a part of the problem of the government, in which laws are being made and they are not enforced in our own country. So you see all sorts everywhere. Sniper has been banned officially, so why is it there? That means the law is not being enforced.
Okay, so having said that, so let's move this quickly.
Yeah.
What is the best way of dealing with drug abuse prevention?
Yeah. Well, prevention starts from before the average age of onset, which is like age 10 now. So, and what do you do at that age? You empower them to be able to say no, life skill training. At that point in time, you build assertiveness, you do assertiveness training, self-esteem. You let people, give them life skills that they're able to say no to drugs. And believe me, those life skills would help in every other areas of life. Because you can't be telling an age 3, you don't even mention such things to children of that age. But you train them to be focused, you train them to be able to assert themselves, you train them to have self-confidence, and it would affect every area of their life, and at the same time affect the substance use. So that's the best way. Of course, we protect them so they don't have, there's reduced accessibility and availability. There's this law that 300-meter radius of every school, there shouldn't be a place where any psychoactive substance is being sold. There shouldn't be, but now in Nigeria, there are no rules to enforce, nobody to enforce such rules. So,
okay. There's just a lot to talk about, Olajumoke, and time isn't our friend today. Yeah. We'd love you to come back again to continue with this conversation on drug abuse prevention, because a lot of youths are involved in drug abuse, so we need to find ways to prevent it. So we're looking forward to having you again on the show. Thank you most kindly, Olajumoke Koyejo. She's a doctor. Are you a general practitioner?
I'm a consultant addiction psychiatrist from Federal Neuro Psychiatric Hospital, Yaba, Lagos.
Okay, great. Thank you once again for being part of the show.
Thank you very much.
All right, I think that's where we draw the curtain on the show. Our time is so far spent. Thank you, our viewers, for being there. Please, let's do this again tomorrow. I'm David Babadike. See you tomorrow.
And I'm Dika Onoma. Have a fantastic day. Bye for now.
Bye for now.
You say something, you say no.